Thanks, Rich. Thanks, Chris. It's a pleasure to be here. So let me first take a pulse of the room. How many people in this room are students in sociology or anthropology? Any economics? How about students in public health? Environmental health? Health promotion, health behavior? Anybody else? Other things?
Psychology.
All right. Good. I didn't mention psychology. You got me. Okay, so this is going to be a conversation as opposed to a talk. As Chris has said, I've been doing this for quite a while. So in preparing this talk, I thought I would present to you some of what's happened and where I think we need to go. And so you're going to be getting a series of almost intellectual vignettes that I'll be presenting. And each of them will have points associated with them. I will, of course, bring a very Texas flavor into this and talk to you a little bit about Texas because it's so interesting and it's so different. It is like Alberta. That's, I will say it's like Alberta. And I'm not a Texan, so I'm an immigrant to Texas, much the same way that I'm an immigrant to Canada. I have actually more claim to Canada than I do to Texas because my mother's Canadian. So if you want to ask questions along the way or even make comments, please feel free to interject. Don't wait for me to provoke you to do it. This should be a conversation. So just so we're all clear, there are differences between Canadians and Americans. And this is just a slide that I like to show to let everybody, make sure everybody knows. You know, at 10 degrees, Californians shiver uncontrollably, and you all plant your gardens. At 32, you all know water freezes, and you all are still doing cookouts. And at 0, the heat turns on in New York City, and Rich can attest to that. And then the Canadian Girl Guides are still selling their cookies door to door. At 60 below, which is minus 51 for you, Santa Claus leaves the North Pole, but you just pull down your ear flaps. At 109 or 79 for y'all, carbon dioxide freezes, and y'all start getting frustrated because your kegs freeze. And then at absolute 0, everything stops, and you all say, cold, eh? And so I'm going to cover a lot today, so we're going to take a long walk on a long pier as opposed to a long walk on a short pier. And so please interrupt me whenever you would like to. Whoops, sorry, wrong way. So first I'd like to talk about academics, because it's important to talk about academics because we're mostly academics in this room. And what motivates academic researchers is not the same as people that are making policy, or the people that are implementing programs, or the people that are worrying about changing practices in labor markets. And we need to acknowledge that. Even though we continue to talk about knowledge transfer and exchange in Canada or translational research in the United States, really, we're about doing research, and this is always going to be one of the problems as we talk about labor markets and we talk about labor market interventions. And this is our first problem, right? People that are doing policy don't talk about interventions. They talk about policies. People doing labor market changes, they don't talk about interventions. They talk about implementing programs to get people to work. People trying to change what workplaces do don't talk about interventions. They talk about how can we change practices. As researchers, we talk about interventions. We have a language that was actually adopted, for all of you that are interested, from the US military. Intervention is a term that was coined by the American military in the 19th century. It's a very military term. And just so you know, here's some recent evidence on our efforts in knowledge transfer and exchange. About 18 to 15% of the research evidence contributes to a change in policy or practice. This is from a recent systematic review of Best and Holmes. And in Victoria, Australia, they actually went into 2 major injury compensation systems and looked at references to published academic articles. These are funders that are making big decisions that are supposedly evidence-based, right? That's one of those wonderful terms we like to use, evidence-based decision-making. and then we publish our papers in peer-reviewed journals, and we produce things like we do at the Institute called At Work, or these general language summaries, and we assume that somehow things get adopted. And here we see 2.1 of all references were to evidence in injury compensation. So if we get to the end of this talk, I'm sorry, go ahead.
So for the first bullet,
yeah.
8 to 15% of research evidence contributes to a change in policy.
Yeah.
That's not the same thing as saying that changes in policy or practice are only made 8 to 15% of the time partially based on evidence. I mean, what it reads to me as is,
yes.
Is that 8 to 15% of research contributes
to a change in, if you look at what's leading to it, if you look at the evidence base for a particular policy or a practice that's out there, most of the change that's being attributed by the people either implementing the practice or the policy isn't the result of evidence.
Okay, the reason why I asked is the statement
yes.
could be read that only, let's say, 8 to 15% of what gets published or folks like us produce contributes to policy change, but that's not what you have in mind, is it?
Well, it sort of is, yeah. I think it would be naive for us to think that, and in fact, I don't think it's naive. I would say in the world of work and health, if you assume that any practitioner or any policymaker is reading the Journal of Occupational and Environmental Medicine or Occupational Environmental Medicine, you're wrong. In the United States, they consider professional safety a peer-reviewed journal. That to them is a high-end academic journal.
Can you, for some of us aren't, so let's say, might not be familiar.
That's sort of like the American Prospect.
Okay.
With more fancy graphs in it. But it's basically all the really talented consultants in the United States write papers there, because that's their business there. But yeah, no, I actually think this is a fundamental problem that we have. And if at the end of this talk, I'm actually going to suggest a different way of doing research. So, this is Texas. Texas is big. If you take your hand and flip it one way, Texas lands in the Atlantic Ocean. If you flip it the other way, Texas lands in the Pacific Ocean. It's a huge state. From 2000 to 2010, it grew from 20 million to 26 million people. That's just the state of Texas. 20% increase in population in a 10-year window. Now, I'm not a demographer, but I don't think it takes a lot to figure out that's a lot. I live here in Houston, Texas. El Paso, Austin's the state capital. It's the most liberal part of Texas. Over there in El Paso is the western part of Texas. On the other side of the border is Juarez. Juarez is where all the maquiladoras are, all the factories that have been built on the other side of the border. Between Houston and Lake Charles, which is up here near Louisiana, 47% of all the petrochemical industry in the United States is located. So in a single industrial sector, 47% of it is located in this place here. We'll return to that when we talk about labor markets. That's our governor, Rick Perry. I'm sure you've all seen him in the news. He's famous for making a lot of pretty crazy statements. Whether he's been high or not, nobody knows. But he's one in a long line of governors, including George Bush Jr. And of course, there's Don't Mess with Texas, which is one of our state logos. That's actually their litter symbol. That's their litter slogan. So you don't mess in Texas. It's a very interesting state. It's the only state that allows itself to secede from the Union. In the Constitution, it can do that. It's the only state that has a state flag that flies at the same height as the American flag. Everything's different in Texas. One of the interesting facts about Texas from a labor market and health perspective that you all will find very interesting is that if you're an employer in Texas, you don't have to have workers' comp coverage. So everybody in the room knows what workers' compensation is, right? So it's a big deal. It's you know, and it's a relationship that was defined in the 20th century, at the beginning of the 20th century, where businesses were obligated to offer this insurance, and therefore you couldn't then take them into tort negligent lawsuits, into these big lawsuits. So in Texas, in many states, you can be part of a public fund, or you can be self-insured or privately insured. In Texas, you can actually be not insured at all. And in fact, over 50% of all businesses in Texas don't offer this insurance. And they don't have to get the workers to sign anything or anything. They just don't have to offer it. It's the only state in the United States that has this. So that changes everything. So the Texas Workers' Comp Commission, which is in Austin, Texas, has very nice data for a very small number of firms in the state. There's over 2 million firms in the state. So you can imagine. So a couple of more things, not only about Texas, but about the United States. And you all know this, we have an aging population. So you all also know that healthcare is covered by the employer in most cases in the states. Not all cases, and that's dropping as well. But as you can see, healthcare expenditures grow up, and so the point of the next couple of slides is to convince you that really, unlike in Canada, where people actually worry about disability and disability management, they don't really worry about it in the States. All they care about is managing their healthcare cost. Businesses are getting eaten alive because of their healthcare cost. And this just shows you we have an aging workforce, and healthcare expenditures rise with age. Whoops. The top 10 physical health conditions. This is another graph showing you the same thing from Ron Getzel and his group that's looking at medical cost, absence cost, and disability cost for the top 10 physical health conditions per eligible employee. So you don't need to do a lot of math here, but this is almost $200 per eligible employee for angina. Short-term disability or long-term disability?
So then the point here is that by far it's healthcare costs rather than disability costs.
Absolutely.
Which is the converse than we would see in Canada.
Yes. And then this adds in presenteeism. So does everybody in the room know what presenteeism is? That's unable to meet the demands of your job because of your health. And you can see that presenteeism is also a larger cost. And again, you see the very small effects for short-term disability and absences. And then this is outpatient and inpatient costs for different conditions. And we actually just finished a series of analyses for the city of Houston, and heart disease and cancer are just eating them alive. Their healthcare expenditures are rising at about a 30% rate a year right now, because they have an average age of their workforce of 47.
How does that 47 compare with the rest of the U.S.?
It depends on, in the public sector, it tends to be an older workforce than the private sector. In the private sector, then it tends to be more what industry you're in. I wish I could say it's because it's unionized. Unionization has been relatively stable in the United States for the last 10 years at about 8.5%, I think, 9%. Some sectors, it's gone up a little bit. So for example, there's been more efforts at unionizing in commercial custodial services. So you see a larger growth there. So so this slide is going to show you then the second point that I'd like to make on medical expenditures, which is that the gorilla in the china closet in the United States is mental health. It's a huge driver of cost. Somebody with a mental health problem consumes about 125% of the health services as somebody without a mental health problem. So they're a big consumer of health care. And then there's just the problems of being managed by it. This is not only a problem in the US, it's a problem here as well. But as you can see, so in the United States, you can imagine when you're a health researcher and you want to talk about labor markets and labor market policies, the most important one for most actors in the system is healthcare. So one solution is you just, have universal health care for everybody. that would cause a nightmare in Texas, right? Texas has the most uninsured children in the United States. They're #1 ranked. %43% of all kids in the US aren't covered by health insurance. In Texas, I think it's like 73%. Yeah, it's huge. Well, you have to buy into health insurance in the United States in different levels, right? So for like CHIP, which is Child Health Insurance Plan, the state has to contribute. So if the legislature decides it doesn't want to contribute, then you don't get any of the federal monies. What's one way to keep down cost? To not contribute. But it really doesn't keep down costs because all those kids show up in the emergency room. So it's really a cost driver as opposed to a cost saver.
I noticed that exercise is on the high risk side. Does that mean lack of, as opposed to being on the low?
Yes.
Lack of exercise.
Yes. Those are modifiable, so yes. So let's turn now to the 1990s. It was such an exciting time in population health. There was a group of us in Boston that were doing a lot of stuff, and there was a group out here that were really doing a lot of stuff. There had been a couple of very important papers that had been published. There was a special issue of Daedalus. Bruce Link had come out with his paper in the 1990s. We came out with the Society and Health book. The group out here came out with the Population Health book. And it was just really a really exciting time. I went on the web and tried to find a couple of pictures. I had forgotten that you had a basketball team. Sorry, but it was an exciting time. And I had actually forgotten about the whole Tonya Harding, Nancy Kerrigan thing. But it's always one of my pleasures when I come to Canada because ice skating is so big here and my daughter's a big ice skater. So I enjoy it a lot. So it was also an exciting time because Whitehall was coming out with all of its results. And so everybody in this room, I'm sure, has seen Whitehall studies before. This is just one example of the 5 million papers that have come out of Whitehall showing a relationship between class and coronary heart disease. You all have seen this before. It's a similar trajectory for men and for women. But what was really exciting for those of us that were interested in work was this discovery of this relationship between class and work. And here I'm showing you some data on the percentage of low job control. Job control is the amount of decision making you have in your job. And as you can see, if you're in the upper segment of Whitehall, you have a lot of control. So 8% of men report low control, or 92% a lot. And but in the lower class for men, 78% report low control. Now, what I've said for many years, and for those of you that are students of organizational sociology or IO Psych, nobody in this room is surprised that when you have a huge bureaucracy, that control is not randomly distributed in that bureaucracy. Whitehall works because it practices control and coordination. This has nothing to do with social class, by the way. It has everything to do with Whitehall being a very effective organization. What has to do with social class here? Has to do with the fact that there's lateral recruitment of people into the classes in Whitehall. It depends on where you went to college. That's how Whitehall works. And so, surprise, surprise. This again is the same slide I showed you. And when you adjust for the work characteristics, the gradient goes away. Lo and behold, the relationship is due to work. So this is a huge finding. And for those of us that were in the middle of this in the 1990s and were interested in work, this was a very important finding. And it really motivated a lot of us to go forward and work on this. And at that point, we were doing a lot of work in job demands, job control. And I put this up here, and you see my title to this because we're still publishing stuff on psychosocial job dimensions that were evolved in the 1970s from surveys developed in the 1960s. And we really haven't moved on this. And so I ask ourselves, why are we chasing our tails on this? And the time has come for us to stop writing papers that say there's lousy measurement of these conditions and then publish papers that show the longitudinal relationships between these lousy measures and some outcomes. Not everybody's doing that, but we continue to do this. I'm not going to talk about it anymore. I actually am one of the key authors on one of the the major papers for the thoracic demands control. It was great when it happened, but I think we would all agree the world of work has changed a little since the 1970s. And it may be that there are other things that are important in our labor market experiences. So I'm not going to talk about this anymore. If anybody wants to bring it up, I'm pleased to do that. Another thing happened in the 1990s, though, was we all sort of got quite enamored. We got involved in income inequality. Income inequality was a sexy drug for researchers. Everybody was doing it. It was easy to do. It was very politically correct to do. And we discovered social capital. Or we discovered Robert Putnam's view of social capital, which is another interesting story we can talk about if you're interested, because that was actually a Cold War version of social capital. And so Richard Wilkinson was leading a charge, also by some of my colleagues at Harvard, Bruce Kennedy and Ichiro Takuachi. And we spent a lot of time, and we've spent a lot of time since then, mining data sets to show relationships. There's nothing wrong with that, and I think it's great to do. But at some point, we need to think differently about these things and ask ourselves, if we really want to change programs, policies, and practices, were these data sets that we're mining going to let us do that? And I think some of the work that Chris McLeod has done, some of the more innovative work in this field, has really taken it to the level that it needed to be taken to. But in the 1990s, we had these two conversions of things where there was this real strong interest in particulars of context that then went away and got lost in this generalities of context with words like income inequality and social capital. We're now going back. We've now discovered that neighborhood is more than just an aggregate of zip codes, and it actually is something. That's great. And we're going to do the same thing in labor markets, and that's where I'm going to take us. But in the 1990s, I was also doing something else. Because I actually believed that if we were thinking about labor markets, we had to actually get out of public health and get into the fields of work. I owe psych, business schools, sociology. Part of my background's in organizational sociology. And so I really knew a lot of this. And there were some interesting things that were happening. So I just want to share with you 3 observations. And this is the first one. This is a story of a company. It's Gaines Dry Dog Food. It was built at a greenfield site. Does everybody in the room know what a greenfield site is? So there's brownfield sites and greenfield sites. Brownfield sites are where you take pieces of land that already have companies on them or other facilities on them, and you convert them into a new production system or new process. Greenfield sites are where you build on a greenfield. Ergo the name. So this was a greenfield site built in Topeka, Kansas, of all places. They did it. They created self-regulating teams with pay tied to skills development. Makes sense, right? Seems pretty good. The physical plant reinforced equality. Sounds good. They estimated there was $1 million a year in savings due to work innovations in this facility. They had lost time accidents was 0 in the first 3 years of operation. That's unheard of. We could say it's claims management. You know, that's what people would say. Absenteeism was between 8.8 and 1.4%. This is a production facility. To have it that low is mind-boggling. When I present this slide to CEOs or big policy people, I ask them the same question I'll ask you. When do you think this happened? "1967, folks. 1967 they did this. These are all ideas. All the ideas for this came from Scandinavia. They knew what to do. They implemented it. What happened at this plant? The manager was moved to a more traditional facility because he was seen as one of the new stars, and this facility was shut down. So, I used to work in the US Congress as a policy analyst. It was one of my side jobs. during that period of time, there was a lot of work that was being done in the Bell companies. This was when Bell split into its 8 operating companies in the United States. So this was the late 70s, early 80s, as a result of a big court decree. That might be one way to reduce Air Canada's travel costs. Break it up into smaller companies, have them compete. That's the American way. Mountain Bell had a series of call centers in Arizona. The Communication Workers of America and Mountain Bell got together, and they completely redesigned the call centers, eliminated supervisors, had self-regulating teams. They saved 3 times the money that the supervisor cost in supervisor salary, increased their performance by 23%, showed increases in customer satisfaction and increases in employee satisfaction that were unheard of in the telecommunications industry. What do you think happened to that company? Again, shut down. They moved the facilities to a place where they had supervisors reinserted. So a third example, a book everybody should read, Christian Berggren's book, Alternative to Lean Production. I don't know if anybody's read it in this room. If you're really interested in kind of the history of assembly lines, it's a brilliant book out of Sweden. And he studied Volvo. And Volvo, of course, is the preeminent company in the world for innovations. And so what they did was they created these brilliant dock assembly systems versus these assembly line, right? And so 10 years later, what do you think happened? They kept the 2 assembly line plants and got rid of all the other plants. There's a lot of reasons why these things happen, but we know how to do this. We know how to build healthy organizations. We know they save money. And we know what works. But we don't do it. And when we do it, we stop keeping it going. It's an interesting problem, isn't it? And what we say in the United States is the market adopts the best practices. If they're shown to be best practices, the market adopts them. Well, I'm here to tell you the single most important labor market policy that we could ever have in the United States is a realization that the market is driven by the government. And once we realize that, we'll be able to affect change in the United States. And I'm going to talk a little bit more about that later. But this all was puzzling me because, you know, here I was. This one was done by Richard Walton, who was at the Harvard Business School. He and I would have these long discussions because I was just boggled. Why aren't people doing these things? This is easy. It makes no sense to me. How can people be so dumb? And, you know, so I said, something's going on and we got to think about how we're going to change labor markets. Excuse me. So, this is from Deborah Davis, a very famous environmental epidemiologist. Some of you may know her. And her summary of breast cancer research at the Crossroads was millions have been allocated to produce what one editor of Lancet described as a glut of the same old studies. So different questions need to be asked to break the logjam. So I was thinking, what are the questions we could ask to break the logjam? And I was very fortunate at the time. A colleague of Chris's and mine, John Lavis, and I were having long discussions about some of these things. And we were trying to figure out how to change how we thought about the social determinants of health. Because the social determinants of health was primarily the 3 red boxes. And then periodically people would allude to context, right? Context matters, but nobody ever defined context. But it was important to think about context. And, you know, then Clyde Hertzman would remind everybody there's a global economy and globalization matters. But, you know, what we did, though, was we ended up here talking about these social actors. Because these are the people that are going to affect change. And the myth of epidemiology is that if I identify these, you can make changes. That's a myth. That works really nicely when you have biological agents. It doesn't work very nicely when you have social change. Social change comes about fundamentally differently. And what we should be thinking about is how these things are affecting all of these relationships. And so I've spent a lot of my time over the last 20 years trying to figure this out. And it's not easy. I wish it was. Here's what I can tell you about labor market experiences, though. I think I can share something with you with some level of truth. Working is better than not working. Chris has a nice piece coming out on this in the American Journal of Public Health on unemployment and mortality. Unemployment is really a lousy thing for everybody's health. A good job is better than a hazardous job. Well, we have some agreement on what that is about. We don't really know what a good job is. And we're not sure we know what a hazardous job is. There's now a debate about shift work. Is shift work a carcinogen? There's a debate in British Columbia about whether, in fact, ergonomic conditions produce MSDs. There's a debate in the United States on this. We can have that discussion. But is a good job a job that doesn't have hazardous work conditions in it? Some people would say that's not a good job. Continuous employment is better than multiple employment transitions. In America, most people will go through 9 labor market transitions in their life, on average. That's on average. If you have a high school degree, it can be as many as 20. If you're a day laborer, there can be as many as 365 a day, a year. And labor market mobility is better than limited skill set employability. We know the least about this, but it really does matter what your skill set is. And I first wrote that in 1999. I don't think it's changed. I don't think our evidence has really accumulated to create anything new. I'd be interested to hear what people think. I just don't think it's changed that much. So this just a little bit, this is why not working is not good for you. You all know this. Good jobs aren't causing illness and disease. These are the illness-producing things for jobs. Good jobs promote health. This is what I think good jobs are about. They have appropriate rewards and support systems. They have a safe and healthy environment, meaningful work, and decision-making opportunity. So I was really, really interested in this idea of agency, the power to affect change. So our psychologist colleagues talk about this all the time. They often refer to self-efficacy as a measure of agency of the individual to engage in behavioral acts of change. Our community-based participatory research people talk about agency in the community. But agency is really action, and it's evidence. And so I tried to do this in several different ways. So the first one was a chair study that I did. I believed that if I showed you that something could actually not only improve health, but improve productivity, that it would make a huge difference. That would create agency. And I did a study that basically showed that with this chair, you improve productivity by 18%. Not reduce lost productivity. You improve productivity by 18% when you have the appropriate training with it. And that it improves health. And we replicated it, so we did it in the private and public sector. So if this was a drug and we did this, I don't know how many people in this room have worked in clinical trials in the pharmacoeconomic area. If this was a drug and we did this, what would happen? If we did the phase 5 marketing studies, marketing trials and showed this, what would happen? Stocks would go up, right? Stocks would go up. You'd see it in the market. That's why everybody got so obsessed about all these researchers declaring their interest in published, because in the 70s and 80s, people would buy shares of stocks before they published their results because they knew they were going to go up. So, here's what happened. And I apologize, one of the lines is very difficult to see. These are the 2 major chair companies in the United States. Between the 2 of them, they own about, now it's probably about 49% of all sales, which is huge for the furniture business. This is when our results were published in 2006, and you can see it really affected their stocks in the right way. They're both the same. Steelcase you can't see here, but it's doing this. It really went down. There were other things that happened. 9/11 sort of killed a lot of things, but still, this didn't happen. So And it still hasn't happened. So that was a rude awakening for me. So having the best evidence it's not going to change decision making of people. Darn it. So then I thought, well, maybe it's I have the wrong evidence. And that I can create agency if I measure the right things. And so I was very heavily involved in measuring health-related work role functioning. Presenteeism, I'm one of the developers of the work limitations questionnaire. And in fact, we have evidence that shows, and this evidence is mounting now, that in fact it matters what outcome you use in return to work. That if you measure just getting people back to work, you target individual medical and legal factors. And this shouldn't surprise anybody in the room. But if you use work role functioning, you target medical care and organizational factors. This is a huge difference, folks. It's a huge difference. If you want to get people back to work functioning well, you have to pay attention to what the organization's doing. And you have to pay attention to what the doctor's doing and the healthcare system's doing. You want to get people back to work, you motivate them to get back to work. Again, this really hasn't had that big of an effect in the United States. It hasn't had a big effect here either. In the States, it's actually been mostly used in the people that are chasing the reducing healthcare cost. And they're trying to justify all their programs, their chronic disease management programs, by measuring these things. But it really isn't doing anything. So, where does that leave me? With a big sigh and a big puzzle. So in our paper, in our chapter, John Lavis and I did define social context. This is a very sociological definition of social context. Nobody in the policy world gives two hoots about any of these things. Nobody in the practice world gives two hoots about any of these things. I mean, you talk to them about social stratification and they go, what? One of the great things that's happened over the last year is income inequality is actually a word that's used in the news media in the United States. It's been used in Canada too, but not in the same way. But none of these things are things that people would talk about in the real world. So we're left at this point where we're struggling with how to think about labor markets. What are they, and how do we think about them? And I just want to pay attention to time because I want to end soon. So I just want to make one thing. An important labor market policy is education. It will continue to be one of the important labor market policies. This just shows that for men, the return on the investment over time is not as great as it is for women. So women, get educated. Sorry, guys. It's true. But here's another thing I want to show you. This is 2 periods of time from 1987 to 1995 in Finland and Denmark, with 2 very different welfare states. And we can have a great discussion about this. But what you should observe is that between that period of time was basically Russia, or the Soviet Union, fell apart, right? And so unemployment in Finland was a nightmare. I mean, it was a disaster because 60% of the Finnish economy was dependent on the Soviet Union. It was a nightmare, but look at what happened. Who has the worst health outcomes? The people in Denmark. Why? Because there's characteristics of the Finnish labor market policies around unemployment that are fundamentally different than Denmark. They have stronger investments in people in Finland to get them back to work, to support them while they're not at work, and to fundamentally reshift the economy. They have a fundamental industrial policy that refocused where work was, and they train people towards that. Denmark was a much more liberal state, more aligned with the Netherlands in terms of its labor market policies. It wasn't as aggressive in terms of trying to estate new industrial policies. So you can see there's a hint here that something that's going on within the state matters. Again, Chris is talking on Friday. Go listen to him. He can say it. I could spend 30 minutes talking about that now, but I don't want to. Another, yeah?
Go back to the last slide for a moment. Have you, I'm just assuming that you've held constant a whole array of background variables that might distinguish Finland from Denmark in terms of health status.
Sure.
Such as diet, exercise, number of
A lot of those things have, actually, because these states have that data. Again, it's not, there's only so much you can hold constant. But yeah.
Okay.
And it's self-rated health, which is another problem. So for many of you that are working in the compensation area, another important policy is workers' compensation and how we do compensate people. If you haven't seen the systematic review that basically says that it's the compensation scheme that causes illness, you should read it. There's a review out there that now says this. And it's the thing now when you go internationally and talk to people. So how come is it somebody who participates in the compensation scheme, their outcomes are better or worse than people that don't? That's basically the question. And so just quickly to talk about this a little bit more, here's a problem in Ontario that you have the same problem. The longer people are off, the more likely they are to stay on benefits. This is not a complicated issue. We had a big policy in 1998 which fundamentally changed things. Sheila Hogg-Johnson has been leading the research at the Institute on this. I won't go into a lot of detail, but basically everybody wanted the insurer to get out of their pockets and to let the market manage things. They didn't touch the injured workers. But they did introduce nurse case managers. And so, as you can see with this beautiful graph, which looks at the number of people that are the risk of being permanently out of work at 5 years following your injury, it was going down. And then the policy change year was the lowest. And then what's happened is it's gone up and it's continued to go up. Now, this is not due to anything else. We have these analyses adjust for like 500 things. It's a sample of, we actually don't do a full analysis of all of the data. It's a sample of the data because we couldn't do an analysis on all the data. But we have, it's in the tens of thousands. And so we have 35, 50 variable models. So everything's being controlled for because we're trying to explain away the policy effect. It's the policy. So what policies you implement matter. There aren't really a lot of really good studies in our field that show that are clean like this. This is going to be, we're still kind of trying to get it published, but this is going to be an important paper. So I'd like to now just spend a little bit of time talking with you all about labor markets. So what's a labor market? I've been using the word, and nobody's really asked me what a labor market is. We use it all the time. Everybody uses these words. Is America a labor market? Is Canada a labor market? Well, there are analysts who treat it that way. Huh? Yes. I don't think we should be thinking about labor markets that way. I actually think we should be thinking about labor markets as place-based. And we should look to our regional economist colleagues who have been thinking about it this way for a century and a half. And Paul Krugman, for those of you who may read the New York Times, he recently had one of the most elegant explanations of a labor market I've seen in a long time, because he was trying to explain why the investment in GM was so important. And there's a lot of people that argue that that was a stupid investment. And what he described was the automotive labor market in the Midwest. And the labor market is really place-based, and it's all the suppliers and the supply chains that exist for companies that are built up to do everything. Because transportation is a non-trivial cost. Location matters. Managing parts and products matters. You have a whole series of ancillary businesses that grow around the core business. And if one goes, everything goes. And so why do people move to China? For the same reason, because there are these huge labor markets that are just built up artificially around a major automotive assembly plant. So in Texas, as I told you, 47% of the petrochemical industry is here. If you go into Houston, this is Houston. So for those of you who've never seen Houston, it's an interesting city, 300 square miles of unzoned land use. No zoning in Houston. None. No zoning policies. So for those of you in Vancouver, you can take your deep breath and thank the Lord. Population of almost 5 million and growing. The 4th largest city in the United States, soon to become the 3rd largest city in the United States. Many, many global headquarters for oil and gas. All along here are huge manufacturing facilities for gas. The Texas City, where's Texas City? Blow my finger. There's Texas City. It was one of the big BP explosions a few years ago that killed 32 workers. And so if you go through any part of this city, there are small companies that employ 30 people that are building one part that goes onto the construction of a valve for a gas refining facility. There are chemical plants that are blending chemicals together that are byproducts of something. There are large companies like Baker Hughes, Halliburton, who are there that are providing services to a large number of other companies in this area. The number of places, if the petrochemical industry were to go under, if gas became, went away, Houston would die. And that's the point that Paul Krugman made about GM. If GM went away, Michigan was dead and Ohio were dead. They were dead. Everything would move out. You'd not be able to rebuild things. It would look worse than the movies that Michael Moore shows. So a labor market is place-based. So think about the policies that you need to think about now. Labor markets are place-based. So transportation policies matter. If you want to support labor markets, you have transportation policy. The transportation policy in Houston is roads. There's no public transportation to speak of. So if you don't have a car, you can't get a job. So one of the things you could do if you actually wanted people to have opportunities was to build a public transportation system. That's a pretty important policy. And in fact, if you look at cities that are growing in the United States, those that are growing have public transportation systems. One of the best economic policies you can have is a public transportation system. They're networked. There's huge networks of people around the city. And there are associations that network people. That's a characteristic of labor markets. It's now facilitated very easy by communication technologies. Wasn't always the case. What's another important characteristic of labor markets?
Consumers.
Pardon?
Actors and consumers.
Yes, actors and consumers. Right. So there's a lot of people that are purchasing a lot of things in this area that make it a productive economy. Houston housing prices did not fall when we had the subprime mortgage crisis. Think about that a minute. That's pretty impressive, huh? You don't want to go to the beaches here. There's little oil spills everywhere, but otherwise, so a labor market, the first thing you have to realize is a labor market is place-based. So what are the other things that matter? Education matters, right? Because you're trying to bring people in, you're recruiting people, and you're retaining people. Healthcare matters. It's huge. The largest medical center in the United States is in Houston. 7,000 beds now in the medical center. It's a city unto itself. So quickly, because I am talking on, I apologize. Here's some other labor market policies that you all probably know a lot about. Does everybody know what a VPPs are? VPPs were one of Ronald Reagan's brainchilds. Voluntary protection programs. Businesses monitor themselves. They build networks and they share best practices. Now they're actually trying to get this codified into law. A $3 million investment for a $350 million return. That's their stigma. That's their catch line. There's never been a single piece of evidence to show that these things work. This works. None. Since 1982.
Has there been evidence to show that they don't work?
There's been no studies of them.
Nothing.
In fact, the accreditation programs that are now going on in our country are all founded on this same paradigm, and everybody believes it. This is the small business version of it, sharp. But this is based, again, on this notion of the market. And the labor market works because people work in the labor market. Another policy out of OSHA. So I think I'm going to stop there, not talk about this, and actually end with a couple of slides that I like to end with. I'm a big fan of Ansel Adams, a photographer. And I always like to remind everybody in the room that we have this model of work now of the knowledge worker, and there's still a lot of people that are out in the fields doing work. And we shouldn't forget them. We should never forget them. I also want to remind people about the importance of expanding our definition of a productive life. We really need to look beyond the business case to the human and social case. There's household functioning, leisure time functioning, college student civic functioning. We really need, it's our responsibility to get people to think differently about what it means to have a productive life. And I think that's one of our great challenges, is to reframe the debate. And I just like to end with one of my favorite slides of all time, done by Marianne Frankenhauser and colleagues. This just shows norepinephrine levels for women and men who are all managers at Volvo. Very equitable company in Sweden. And it shows that when women go home at the end of the day, things go up, and when guys go home, it goes down. So when we think about meaningful work, we need to always remember that there's different forms of work, some of which people get paid for, and some of which people don't get paid for. But it's all work. And again, as we think about productive lives, and we think about labor markets that are supporting productive lives, we really need to think differently about the policies than we have already. Thank you. And I'll take questions. Yeah, Rich.
Probably less of a question, maybe just sort of amusing to throw out there.
Good.
Thank you. This is a very, very stimulating talk. It seems to me, so I don't do any work in your area, but it seems to me, in terms of thinking about some commonalities between what I do and what you do, and what other people in the room do, and as researchers, it seems like it all seems to come back a lot to construct work. But there's a lot of measures of things, but not necessarily, as you're bringing up with your talk, some theoretically rooted types of constructs of what we're linking things to.
Yes.
So
It's
I don't know where to go
no,
with
that's a great comment. It's the illusion of social epidemiology, which is this belief that somehow we've now constructed these concepts that have validity to them. So, for example, social capital. When if you actually look at social capital and its use in social epidemiology, it's been, it's nuts. Trusting your neighbor, I don't think, is a measure of state-level social capital. Sorry. Yeah, I think it is. I don't think we've thought about some of these things as much as we need to. And again, I think part of the struggle is that it's not what researchers in public health are incented to do as much as they should be.
So this idea, I was sort of thinking...
But you're correct. Labor markets, we haven't thought about labor markets. We struggle with exposures, right? So for years, everybody was talking about work organization, which was this notion of this integrated model of work versus this notion of having physical exposures and psychosocial exposures. But really, that's never evolved into what I would consider to be a good body of evidence. We continue to talk about the content of work, but we really don't have good measures of it that are valid. So, I mean, in fact, the best developments are in health-related work role functioning because those are measures that big pharma companies want.
So related to that, just as so as you're talking about the notion of a good job,
Mm-hmm.
I mean, is this, if I'm understanding this correctly, I mean, is this really just sort of like the classic story of somebody loses their keys, they don't know where it is, and somebody says, they lose them over here somewhere, and somebody's over by the lights. Why do you look? Oh, it's easier over here.
Mm-hmm.
Is this really the case of really collecting the data and really a problem of an inductive kind of method versus something that would be more drawing from other examples, using much more of a deductive type of theory building in order to apply it? Or am I going even...
No, I mean, others in the room should jump in. I mean, I've been looking and thinking about what meaningful work is for a long time. One, it's hard to measure quantitatively. Two, the question is, where do you want to target your interventions, or where do you want to build policy and programs and practices? And I think the consensus is is that the focus on the job may not be the right focus. We should be really looking at something bigger if we want to affect change. So in America, really, we're pretty boring right now. We're, as you know, we're hoping that unemployment benefits get extended by the Congress so that people actually have benefits. So it's a pretty simple state of affairs in the US, but it could be quite complicated. Will we go back to a model where actually people care about work? My experience, and think about it, I think people are. You're seeing it. Creative people are getting published in Harvard Business Review about job crafting and thinking about jobs differently. Amy Wisniewski, who's a very, very smart IOCite person, has published there and has a series of papers that she's done, very thoughtful on work as vocation. There's been a variety of psychologists that have written on this. Chris Jenks at Harvard Kennedy School has written on this. So the people thinking about it, that requires a paradigm shift organizationally for a public health community which focuses on illness and injury and disease and not on health. We talk about health, but really in the end, you know, our dollars are more based on risk.
Well, I mean, the International Labour Organization has been pushing the idea of the right to be for quite some time.
Yeah.
But it's not talked about.
No.
Yeah, thanks for the presentation. I got a comment and then I guess a couple of not so much questions but prods for you to say more in one or two areas. And your picture of the workers working in the field, of course, reminded me of the very recent tragedy of the farm workers in Ontario who lost their lives a couple days ago. And that, you know, we as health researchers and work in health don't actually spend a lot of time focusing on some of those basic risks to which you know, a lot of the most vulnerable workers are so exposed to. I guess one thing I might want you to speak to for a few moments is, you know, we do have a lot of students here from our environmental and occupational health program here, and you know, who are going to go out and, you know, be occupational health and safety and hygiene officers in this context. You know, what sort of, you've sort of had to summarize the one or two key things that, you know, you wanted to impart to them from your talk. What would that be then?
It probably wouldn't be from that talk. It's you have to spend a lot of time creating an engaged workforce, right? That's the trick. You got to engage people in discussions about occupational safety and health in your workplaces. That can be done in a lot of different ways. It can be done by talking to people about the things they should be doing that they're not doing. It can be doing audits. It can be doing a lot of different things. I just actually spent 2 days at a company in Houston that received $1.5 million in OSHA citations, and were put on the severe violator list, which is like, that's bad. It's bad. And almost all of the violations were inadequate machine guarding, inadequate training, inadequate lockout tagout, and they had to get all this done in like 12 days. I mean, I don't know if we've all read an OSHA citation before. It's a real interesting exercise, but you know, they come in and they give this to you, and then you have a certain amount of time to get it done. And then I was sitting there talking to them really about how to change the environment, because they said, we don't understand. We told anybody if there's a problem, they should come into the president's office and talk to them. And I said, okay, when did you do that? Oh, we did that 6 months ago. How many people have come in? Nobody. I said, really? But they had 3 people call OSHA and complain about the health and safety problems. So you have to create an engaged workforce. And I think Chris is right. I was recently at a meeting with 15 of the top health and safety people from petrochemical around the globe, and they've all moved away from safety culture and all this other stuff. They've discovered that the basics aren't being covered in every facility. So they're going back to basics. So that's my advice to, you know, engage and focus Yes.
Just a question, actually, if you'll forgive me, a series of questions, which are follow-ons to what other folks have already said. But
It's okay.
you know, when I think about the Tacoma, about the Topeka plant and the Volvo experiments, there's various reasons that one sees why they, for why they haven't, or alleged reasons
Yeah.
for why they haven't proliferated or been continued. And the one that I find most troubling or convincing is not everybody wants that kind of job. There are people who like to be engaged, and there are people who want to go home, practice their hobbies, or take care of their kids. There are people for whom a good job is one that offers mobility. There are people who don't really care that much about it. You can condemn modern bureaucracies such as Whitehall because people don't get to decide and participate. On the other hand, there are people who would prefer not to. So in terms of figuring out what a good job is, obviously you don't want one with industrial hazards and exposures. But engagement, I'm not sure, is something that everybody wants. And so let me just pause there and ask to what degree, since you and I would value engagement, but we assume other human beings might not, what's the alternative? How do we actually get people engaged, and to what degree does engagement have a potential for being something that would involve something approaching the majority of workers in the United States or Canada or elsewhere?
Right. So this is part of a bigger debate in public health in general, because the same set of arguments can be made for those people that are working with communities. That there are communities that they don't want to, they like what they have, and they don't want people to come in and muck around, even if it might improve conditions, because and you have to respect that, right? And the same thing's true with work. There are workers that like their job. They like sitting on the assembly line, as Henry Ford said. And they'd like to do their mindless job and then go home at the end of the day and just watch TV.
Or play soccer.
Or play soccer.
Or teach their kids mathematics.
But the thing is that one of the things that we know is that most of the people that are in those mindless jobs don't go home at the end of the day and play soccer or teach their kids mathematics. Instead, they go home and decompress from a completely alienated job. So the job has a long reach out into the other parts of life. And it has huge impacts for, we didn't talk about this, has huge impacts for child development, the type of job the mother has. And there's been some really wonderful work done by Betty Menahan, a sociologist at Ohio State, on this, and Toby Parcel there. But so I guess, see, my answers would be different for why they worked and why they didn't work. Cow-Can didn't, or Gaines dry dog food worked. And the reason it didn't work was because the employees couldn't tell somebody not to get a pay raise when pays were tied to skills.
Wasn't there also a union issue there?
In Topeka, no, they didn't have big union problems there. That wasn't their problem. Their problem was, so that plant, this whole thing gave rise to organizational learning, right? So the whole problem with some of the early generation changes was that organizations did it and they stuck with it and they couldn't learn from the experiences and change. So then Peter Senge came along with the fifth discipline and suggested that we needed to have learning models of organizations and that you had to create that. I don't know. I think Mountain Bell was all about the union. That was about labor management, conflict.
No, so union contracts tend to
but that wasn't what happened.
Oppose this kind of innovation.
Right, but the unions were the innovators. And they took pay cuts and everything. So that was the funny thing about that one. And the lead on it was actually the chief human resource officer for AT&T, who got all these concessions, if you want to say them, had the agreements done. So it was strange, but it ended up there. The Volvo facilities, the CEO basically said, I mean, they were on record as saying, we couldn't plan well with the dock assembly systems. We planned better with assembly lines, both for recruiting workers and everything. You have to have a different kind of worker in a dock assembly. They have to be engaged and everything. So it wasn't that the worker wanted it. They had to have a different worker. You had to have a skill set. And that's one of the problems. The beauty of monotonous alienating work is you can take somebody with an 8th grade education and they can do it. But most people in most labor markets in the United States don't want that. They want the educated workforce. They want the literate workers because most jobs require some level of literacy in them, the functional literacy, just to be successful. So I don't know that we have a good answer to this. I'm never one that says that I'm continually surprised by the facilities that I go into, and I start talking to workers in those facilities how much they want to improve their work and how much they've thought about it. So I'm always amazed at it, personally. I mean, as a practicing ergonomist, I go into plants, and my story is you don't need to pay me $2,000 a day for the stuff that you should be paying me $2,000 a day for, because what I usually do is go around and talk to the workers and say, how would you fix this? And they have a better solution than I could ever come up with, and it's like a lot cheaper. So I look great. So I don't find this. When you find disengaged workers, they're disengaged because there's something that's going on in the workplace that's disengaged them, and not anything else. That's been my experience. So this is the story that's given all the time in Texas, right? That the Mexicans come up and all they really want is money to send back to their families in Mexico.
Is there a population-based data surveys that would give you the same findings?
No, we haven't. Again, that hasn't been. We suffer under the hegemony of the job demands, job control model. So that's what gets put in most, or we have one question on job security. So again, it's a construct validity issue as much as, that's where all the work needs to be done. So I think many of the questions you're raising are really construct validity. I mean, I think this is the right debate to be having. We just haven't been having it.
I'll give you a little background. I teach organizational behavior.
Yeah.
Been doing it for quite a number of years. And I began thinking the Volvo and the Topeka plants were the greatest thing in the world, and asked the same questions you did. If it's such a good idea, why aren't people doing it? Why doesn't it get picked up? But it hasn't, and there's got to be a reason. There have to be other reasons. It could be that there are diseconomies associated with it. It could be that the worker attitudes are not consistent with it. I don't have an answer either, but it's something that's really worthy of folks like us to think about.
Yes. Well, my cynical answer is the same answer that I usually give now, which is that, and this is actually a good lesson. You'll get a great education here. One of the things you'll find 20 years from now is the education you got here was a great education, and you'll have a plethora of consultants that will be coming into your offices trying to sell you all these things and tell you that they're new, and they're the same things you got in your education. There aren't that many things that are that new and that innovative, and that a lot of things get repackaged all the time. And so one of the reasons it's difficult to follow how things are getting adopted is because, the flavor of the month is Peter Senge in the 1980s and Michael Hammer in the 1980s. Then in the 1990s, it was Jim Collins and others. And so, but it's all reinventing the same things. They're all, and if you've been following organizational behavior, it's the same. I mean, there's changes theoretically, but the theoretical stuff hasn't really, I think, played out. So the fundamental problems are the same. You organize things, you organize businesses to affect people, to do things.
Ben, it was really intriguing your slide where you sort of juxtapose return to work and work role functioning. And from a Canadian perspective, particularly when we think about compensation boards and occupational health and safety, focus still largely remains return to work, return to work, return to work. And there doesn't seem to be that much traction, at least to my mind, that, thinking about work role functions, which gets more presenteeism, is really a priority, for our compensation boards and more broadly speaking. Is that just because of how we've structured the system, or what are we doing wrong here?
Oh, I think we're listening to the wrong people. I mean, if you talk to the injured worker, they're going to tell you they want to go back to work and function well in their job. They're not dumb. They've figured out what their viability in the labor market is. Injuries don't help you be effective in working. So, I mean, this didn't come about because we were going around talking to pharma. When we started inventing this stuff, it was because we were having these focus groups with injured workers. And we were actually testing the SF-36 out. And everybody kept talking about work. So the SF-36 is a measure of health-related quality of life. And so yeah, and I don't think we've been talking to the healthcare providers because we often ding healthcare providers, but they actually want to get people back to work and functioning well in the job as well for the most part. They actually do care about it. And instead it's the compensation system and what they're incenting. It's sort of like the old joke with job brokers, right? So in the old days in training programs, there was job brokers who would get people jobs. And they were incented to get somebody a job, not to have somebody get a job and keep a job. So they loved people that worked in transitional areas where they would come in and out of jobs and cycle through because they looked better. So yeah, no, I think it's one of the problems, and I don't know how to change this one. I really don't. I can tell you the solution in Ontario is to basically, Ontario has a $15 billion unfunded liability in its compensation system now. So for those of you in BC, this is like mind-boggling, right? They got $15 billion they got to cover, folks. It doesn't look good. It's not pretty. So and it's all those people at the deep end, right? They have a bunch of people that just aren't going anywhere. And so what they're doing now is they've really changed their models, and they're investing heavily up front. And they're trying to touch people early, and they believe that if you don't get them before 6 months, then you have big problems. It's a completely different model. Yeah. Does anybody have any ideas? I don't know. I'm bemused by it. In Europe, they don't call it presenteeism or health, they call it workability. And there it's very big. And in fact, the European Union is hugely funding work in this area now. That's what they're incenting.
Do you think in Canada and perhaps more broadly in North America, I think it has to do with that, we've got a history of adversarial relationships between labor and business, and so we're not able to sort of create a coalition between workers and employers to actually have a conversation about. Actually, I really like the term workability rather than presenteeism or work role functioning.
I like health-related work role functioning better than workability, but that's okay.
It rolls
I don't like presenteeism either. Presenteeism is a bad word. Bad word.
But anyway, that's beside the point. But does it have something to do more broadly with actually how we structure our work and organizational relationships so that we can actually create the work and employer coalitions to actually make this a focus?
Possibly. See, again, this gets back to the same old story. Every time you show that some innovation or some program or some policy has win-win-win to it, it still doesn't get adopted broadly. So it's a tough one. As my safety colleagues in the US say, if it's regulated, I can do something about it. If it's not regulated, it's almost impossible for me to do anything about in health and safety. Unless you have a kaboom. Then you can do whatever you want. The money flows then.
Sometimes I wonder if it's not all a matter of hopefulness by humankind. You know that you can improve your condition, you can take care of your health, you can get what you need from your job depending on what that is. Yeah, that's not a very scientific concept, but I wonder if there's any grain of truth there, and if that's something that is possible for policymakers or researchers to promote.
Right. Well, that would be a social justice perspective, yes. Mika, you had a question earlier?
I guess I'm intrigued a little bit about if we're thinking policy and making for good jobs, where the next big policy lies. Whose responsibility is it? We've got workers' compensation systems around health and safety. We've got labor, government around minimum wage and labor standards, and we've got our public healthcare system, at least in Canada. I'm just trying to figure out, we're going to push the envelope and improve jobs. Where does the next big policy rest?
Right. That's a good question. It could come out of, in Canada, it could come out of the emergent coalitions around mental health and work. which are fairly broad and large in Canada in a way that they aren't in the United States at this point, and very much jointly industry, labor, government run. So that might be one place where people talk about it. It could come at the confluence of school to work transitions and hold the whole idea of jobs and delinquency and deviance, where certain types of work are associated with transitions of people out of certain life stages into others. I don't see it coming out of an industrial policy, though. In fact, you know, I kind of puzzle about industrial policy in Canada right now, because they've had their big hit with manufacturing. But, so I mean, that's the big question. I'm not sure that that's where the most important policy should be. But I mean, I don't think we've got a good framework for thinking about that. What we have is a patchwork quilt of policies that we hope capture different things, with different coalitions engaged in different pieces of it.
Which is not a bad model, I think, in terms of having different organizations responsible for different aspects of making for a good work environment. But I'm trying to figure out if I was going to help in terms of evidence or
I think,
working with a group where should we be looking to?
Well, you know, there's been windows of opportunity in the United States about this at different points in time around literacy and educational literacy and work. And so there's in the greater Philadelphia, Susquehanna Valley area, all the manufacturers there got together and worked with the school system to try to figure out how to get people to work in jobs that were good for them, but also were reciprocating to the communities. It's tough. It's tough today. I don't really know. I don't know that even in academics we have the right models. So I think part of the challenge here, and I didn't spend a lot of time talking about it, is I'm into embedded research now, which is to say that, you know, we do research right at the margins. We work with the communities and the practitioners to do the research. We don't just, and so in some sense the constructs are emergent from the engagement and we don't bring them to them. And so all the stuff that we're doing now on leading indicators work, it was all done that way. I didn't show up with a classic organizational model of culture or climate or all those things. We came up with questions that meant something to people out there. And it's fundamentally changing the dialogue. And it's interesting to watch now in Ontario where the Ministry of Labor is trying to change the dialogue. And now the practice community is not letting them. So there's an interesting change of the debate that's happened because the words leading indicator have now been co-opted by the practice community. And the Ministry of Labor wants it to be about internal responsibility systems because that's what's in their legislation. But most of the employer, all the other communities go, no, 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 it has to be about this now. So there's an interesting tension. So I actually think that's the way to go. I think we've got to move out of the models of, and that requires funding be thought of completely differently. Because this work all started basically pro bono, which I was lucky enough to have a moment in time to do. But that's tough to do in academics. That's why I start with the slides about what we do in academics, because we're often very much constrained by our own stairs that we have to walk up and down. But those of you that are going to be practitioners, you can do it. That's where it's at, right? So that's the story of leading indicators. I brought together 30 practitioners and said, okay, think of a ruler. You got to figure out how, if you have 100 firms, you're going to ask them a small set of questions, and you get the good people at the top and the bad people at the bottom and the okay people in the middle. How many questions do we want to ask? And they said, oh, less than 10. I said, okay, let's do it. So what do you ask? We went around the room. I said, what do you ask? What's the first thing you'd ask? And we basically just got everybody to list what they thought the right questions were. You know, people with lots of gut experience. We ended up with 8 questions, had complete consensus from all the stakeholders, all labor and everybody in the province. 8 questions. And it actually turns out that those stinking 8 questions predict workers' comp injuries and illnesses. Has no construct validity, none. It's very humbling. It's exceedingly humbling as a researcher. But now I get to do now I can look at all the more bigger metrics and show why it works. But I think there are reasons it works. But anyhow, we're going on now.
Good stuff. So
Thank you all. That was great.
thank you
Great
very
discussion.
much, Ben.
Thank you.